Craig here with Get in Position as it relates to your health. I'm inside of the Kidney Korner, and I'm bringing you some more information and education as it relates to your kidney health. I'm bringing you today 8 possible trouble signs of early kidney disease. Early kidney disease. And you want to pay attention to these things because I ignored a lot of these signs myself. And as we know, kidney disease, high blood pressure, diabetes, the silent killer. You don't really feel anything. And this information is actually coming from the National Kidney Foundation. So you can go to www.kidney.org. That's www.kidney.org. So here's the first thing. The first trouble signs is fatigue and weakness. If you're always feeling fatigue, if you're always feeling weak, you don't have a lot of strength, pay close attention to that. Number 2, difficulty and painful urination. When you go to the restroom and it's difficult to urinate or it's very painful to urinate, that's a sign, that's a flag. Pay attention to that. Pay attention to that. Number 3 is really, really important, especially for me. It's foamy urine. Foamy or frothy urine. When you see a lot of bubbles, if you ever seen a bartender or someone pour a glass of beer and that foam at the top, if your urine looks like that, that's a sign. That's what happened to me. I ignored it. Didn't know what it was. I thought it was what I was eating or what I was drinking. And by the time I got to the doctor, I went to the doctor for something else that was troubling me. And the nephrologist asked me, did I ever recall seeing that? And I said, yes. And what it was I was spilling protein in my urine, and that is not supposed to happen. Your kidneys is not supposed to let urine pass, but protein pass through. It's not supposed to do that. You need protein for your muscles and so on and so forth. And I explained this in my first episode from diagnosis to transplant. It's now on YouTube. Go to our YouTube channel. Check it out. The first episode is called The Diagnosis. And I discovered that 23 years ago. 23 years ago. So please pay attention to what you're putting out. Okay? So the fourth thing is pink or dark urine. That signifies there's blood in your urine. We need to pay attention to what we're putting out as well. Number 5, an increased thirst. If you're thirsty, all of a sudden you're just thirsty all of the time, pay attention to that. Why is that happening often? If it's happening often, if you noticed it and it happened again, and then it keeps, pay attention to that. Number 6, an increased urge to urinate, especially at night. Many of us already know our sleep patterns. If you have a strong urge to go to the bathroom, you find yourself up a lot at night, pay close attention to this sign. I would go even a step further to say you may want to check your blood sugar levels, have that test done, because the number 1 leading cause for kidney failure is diabetes. And one of the symptoms of diabetes is having to urinate often. So you want to pay close attention to that and just check it out. You may be on the borderline, you don't know. It's possibly something that you can correct with just your diet and exercise. So check that out and pay close attention to that sign. Number 7, puffy eyes. We should all be, examining ourselves everywhere, our eyes, our skin, our tongue. If it's discoloring in our tongue, we should be examining everywhere of our body. I know for women, and it's Women's Month this month as well, as it relates to breast cancer and mammograms, examining yourself. And even for men, my brothers out there, examine yourself. Examine yourself, your testicles. Examine if you find different lumps, even in your chest as well, because men are prone to have breast cancer as well. So we got to feel around for lumps and all types of things. So take care of yourself as it relates to your health. And number 8, the last one, is a swollen face. That goes back to looking at yourself and paying attention to what's going on with you, how you look. Hands, swollen hands, abdomen, ankles, and your feet. The reason why your ankles and your feet, because if you are retaining fluid, because one of the things in the last video I told you or shared with you is that your kidneys are supposed to regulate your fluid levels. So if you notice that you are retaining weight, water weight, also too, watch your sodium intake. Watch your sodium intake. Read the labels. Read the labels on your food that you buy. Listen, that's all that I do now. When I go shopping, when I go out, I'm reading all types of things. I know that I was on a low protein, low potassium diet. I had to read those labels and try to understand what some of those ingredients meant, because they try to disguise them in certain words and terms that we don't even understand. Listen, we have information at our fingertips. We always on. Let's educate ourselves as it relates to our health. Let's take more notice of our bodies. If it's a red flag, please do not ignore it. Do not ignore it. Oftentimes, when we get to the doctor and we're finding out that we have chronic kidney disease when it's too late, it's just far gone. That's what happened to me. I'm not trying to chastise anybody because it happened to me. It happened to me. I went to the doctor on something else, and I wound up finding out I'm stage 3 CKD. Stage 3. My kidneys were kaput. They were damaged. They already had damage on them. So please, early detection is great. Early detection is good, so your doctors will know how to treat you, what to do. We could catch it early. And I've even heard some people who have reversed. They got early detection and they was able to reverse a stage. So maybe coming from 3A down to 2, which is good, depending on what was going on with their kidneys. Now, for me, go watch episode 1. Just go watch episode 1, the diagnosis, on our YouTube channel. Listen, this is Craig in the Kidney Corner with Get in Position as it relates to your health.